My name is Jeremy Peterson. I'm a student physical therapist at Campbell University, and today I'm going to demonstrate the bicep squeeze test. The bicep squeeze test is a special test that is used to determine the presence of a rupture of the biceps brachii tendon. This test was found to have excellent sensitivity and specificity in the original cohort from whom the study was developed. The test is performed with the patient seated and the forearm resting in the lap. So in this case, with this particular patient, I'm going to have the forearm resting in the patient's lap, the elbow flexed to about 60 to 80 degrees, and the forearm is going to be in slight pronation. So just beyond neutral, kind of going toward pronation. In this position, the moment arm of the biceps tendon is primed for supination. So the clinician is standing on the involved side. And standing here, I'm going to squeeze the biceps muscle firmly. And while I'm squeezing, I'm going to palpate over the distal forearm. And I'm going to feel that radius want to come into supination as I squeeze the biceps brachii. So in her case, she's going to have her forearm wanting to come into supination because she has a non-ruptured normal biceps tendon. So a lack of forearm supination when the biceps is squeezed would indicate a positive test and a suspected rupture of the biceps brachii tendon. All right, so the whole point in that test, kind of squeezing on your upper arm there on your biceps, we're trying to see if there's a break or a rupture in the tendon that connects that muscle to your bone down here in your forearm. So since whenever I squeeze on that bicep, there was normal movement in your forearm, we suspect there's probably not a tear in the biceps tendon. Typically, if there is a tear, you would have a lack of that movement because whenever you squeeze, you wouldn't have that tendon pulling on the bone whenever I squeeze. So in this case, you had a normal test. It's not a positive test, so we don't suspect any kind of issue with your biceps tendon. Earlier, I mentioned the original cohort from which the bicep squeeze test was developed. This study was in 2005 in the Clinical Orthopedics and Related Research Journal. In this study, 21 of 22 patients with a positive bicep squeeze test had operative confirmation of complete distal biceps tendon rupture. All patients who had surgical repair of the biceps tendon had return of supination with a bicep squeeze test immediately after reattachment and at 3 months follow-up. 65 patients with no history of upper extremity trauma were used as a control group. All of these subjects tested negative on the bicep squeeze test. This study, from which the bicep squeeze test was proposed, provides good evidence for this test's specificity and sensitivity. However, further study is warranted to corroborate the value of this test for use in the clinical setting.